How to perform CPR, life-saving steps for heart attack and cardiac arrest. Every year, hundreds of thousands of people suffer cardiac arrest, and knowing how to perform CPR can mean the difference between life and death. In this video, we'll show you the exact steps to perform CPR and rescue breathing using stunning 3D medical animation. What is CPR and when do you need it? CPR, or cardiopulmonary resuscitation, is an emergency life-saving technique used when someone's heart stops beating or they stop breathing. This can happen during a heart attack, cardiac arrest, drowning, or choking. Immediate CPR keeps oxygenated blood flowing to the brain and vital organs until professional medical help arrives. Step 1. Check for responsiveness and call for help. First, check if the person is responsive by tapping their shoulder and shouting. If there's no response and they're not breathing normally, immediately call emergency services or ask someone nearby to call. Time is critical. Brain damage begins within 4 minutes without oxygen. Step 2. Position the person correctly. Lay the person flat on their back on a firm surface. Kneel beside their chest and expose the chest area if needed. Step 3. Perform chest compressions. Place the heel of one hand on the center of the chest between the nipples. Place your other hand on top and interlock your fingers. Keep your arms straight and position your shoulders directly above your hands. Push hard and fast. Compress the chest at least 2 inches deep at a rate of 100 to 120 compressions per minute. That's about the tempo of the song Stayin' Alive. Allow the chest to fully recoil between compressions. Step 4. Give rescue breaths. After 30 compressions, open the airway by tilting the head back and lifting the chin. Pinch the nose shut. Take a normal breath and make a complete seal over the person's mouth. Give 2 rescue breaths, each lasting about 1 second, watching for the chest to rise. If the chest doesn't rise, reposition the head and try again. Step 5. Continue the cycle of 30 compressions followed by 2 rescue breaths. Don't stop until professional help arrives, an automated external defibrillator becomes available, or the person starts breathing normally. Important notes. For untrained bystanders or those uncomfortable with rescue breathing, hands-only CPR, continuous chest compressions without breaths, is still highly effective and recommended. For infants and children, the technique differs slightly with gentler compressions and different hand positions. Remember, acting quickly saves lives. Even imperfect CPR is better than no CPR. You could be someone's hero. If you want to learn more life-saving medical techniques through 3D animation, subscribe to our channel and explore evidence-based health content.